Hey, welcome to today's lesson. We're going to be talking about the immune system, specifically chapter 16. So this presentation will focus on understanding the mechanisms of immunity, exploring how our body defends itself against harmful pathogens, and the roles played by various immune cells and molecules. So our learning objectives for the lesson, you can read here. We're going to compare and contrast the innate and adaptive immune systems, look at primary immune system, identify major immune deficiencies and their causes. Okay, so the immune system is a complex network and it's designed to protect the body from pathogens, foreign tissues, cancer cells, and it consists of defensive cells and molecules that operate through two different primary systems. And that is called innate immunity, which is a non-specific defense system that acts as the first line of defense. We're going to talk about that in more detail. And then adaptive immunity is a specific acquired system, and that's tailored to very specific invaders. And so we'll get into these functions and how they work and interact. So with innate immunity, um, and adaptive defenses, they are intertwined, they're connected. So through innate immunity, it's non-specific, it works closely with the adaptive system by releasing proteins that signal the presence of foreign molecules. And that signal will activate the adaptive defenses. So together they form very cohesive defense mechanism against threats to the body. So innate immunity, it's always ready to act. Um, it's always ready and it acts within minutes to prevent the entry or spread of pathogens. So this is the first line of defense, and that's external barriers like your skin or mucous membranes. Okay, the second line of defense, that's internal defenses, which we're going to talk about each of these in detail, but phagocytes, natural killer cells, the inflammatory response. So this system significantly reduces the workload of the adaptive immune system. So again, the first line of defense relies on physical barriers such as the skin and mucous membranes. So these barriers, along with their secretions, help prevent pathogens from entering the body. And you can find this table in your book, but I would recommend looking at this table a little bit more in detail to understand what the first line of defense entails. All right, so when pathogens get past the first line of defense, like your skin, say like if you have a cut and that will allow microorganisms in to the deeper tissues, then that initiates the second line of defense that has the internal mechanisms. So this would include phagocytes and natural killer cells, the inflammatory response, which is the hallmark of this defense, and then antimicrobial proteins and fever, which all inhibit pathogen spread and replication. Um, these are going to be really important to understand, especially when we talk about periodontal disease. Your perio class is going to be mainly talking about the inflammatory response, your immune response, because that has so much to do with periodontal disease and bone destruction around teeth. So this is going to be a really important chapter to understand because it's going to be the basis of everything that we do as a hygienist. Okay, so phagocytes, they are white blood cells that engulf and digest pathogens. There are two main types. So neutrophils are the most abundant, and they're the first responders, but they are very short-lived. They die quickly. Um, Macrophages, they come from monocytes, and they are the primary phagocytic cells that arrive after neutrophils. So when we get a cut and it starts to get infected, you see pus coming out of it, right? What that is it's neutrophils and phagocytes that are eating the bacteria. They're ingesting these foreign invaders and then dying off, and that's what that white pus is. It's what you're seeing, um, how our body is fighting off these pathogens. All right, so when we come to natural killer cells, they are an essential part of the innate immune system. So they act as the frontline defenders against abnormal cells. So they are large granular lymphocytes. They specialize in targeting virus-infected and cancerous cell. So how they work is they detect the abnormal cells, identify that the cell is lacking self markers, um, and then they are often reduced or absent, infected, or cancerous cells. So infected or cancerous cells, they usually don't have these self markers which identify what type of cell it is. It has the cell surface receptors to identify what that cell is. So when this happens, then there is secretion of cytokines, and the natural killer cells produce these cytokines. Example would be interferon gamma, which activate other immune cells. So it sends out a signal to activate macrophages, so it enhances the overall immune response. It also releases inflammatory mediators that help recruit additional immune cells to the site of infection and injury. So, things that you want to remember about natural killer cells is they act rapidly without requiring prior exposure to that pathogen. They bridge the gap between innate and adaptive immunity by interacting with other immune cells, and their activity is tightly regulated to prevent damage to normal healthy cells. So these are all characteristics that make natural killer cells a really important part of how our body defends against infections and tumors. All right, so inflammation is the body's non-specific response to injury or infection. So it is a protective mechanism that is designed to prevent the spread of infection. And it does this by isolating pathogens and preventing them from spreading to nearby tissues. It also helps to eliminate debris and pathogens. So immune cells clear the area of harmful substances like dead cells and pathogens. The inflammatory signals attract and activate adaptive immune cells to provide a more targeted response. So it helps to alert the adaptive immune system. It helps to facilitate tissue repair, and it does this by increasing blood flow and delivering nutrients and growth factors to the affected area. So inflammation sets the stage for repair and regeneration. So again, if we go back to, you get a cut on your finger, what's the first thing that happens is that it swells, right? And that's because of this inflammation response. It's sending a lot of blood flow to the area. And so it's going to have a lot more of that blood flow, a lot more of the immune response in that area to try and heal the tissue and fight off those pathogens. So there is different types of inflammation. So you have acute inflammation, which is it's short-term response. It's characterized by rapid onset and resolution once the harmful stimulus is eliminated. And an example would be that would be cuts or infections. And then you have chronic inflammation, which is the prolonged response that can result in tissue damage due to continuous immune activity. So examples of that would be autoimmune diseases like rheumatoid arthritis, but this is also where periodontitis comes in. It is chronic inflammation in that area due to continuous immune activity of the body trying to fight off oral bacterial pathogens around the teeth. And you'll get much more detail in your perio class. But this is very key to, like I said, what we do with periodontal disease as a hygienist. So some key things that you want to remember about the inflammatory response. It does have chemical mediators, which are substances like histamine, cytokines, prostaglandins that initiate and sustain the inflammation in the area. You have vasodilation, which allows the blood vessels to expand. So you get that increased blood flow, which creates redness and heat. Then you have increased vascular permeability, which that allows fluids and immune cells to move into the affected area from the blood, and that also causes swelling and can be painful as well. And then it does recruit other immune cells, so phagocytes, like the neutrophils and macrophages that we talked about, that help to ingest and engulf bacteria or other microorganisms. And it brings them to migrate to the site to eliminate those pathogens and promote healing. So inflammation is a critical component of the immune system's defense and repair mechanisms, but it must be carefully regulated to prevent excess tissue damage. And that's what happens in periodontal disease, is it has too much tissue damage. So there are 5 classic signs of localized inflammation. So redness, heat, swelling, pain, and loss of function. So these signs indicate that the body's active defense and repair mechanisms are active. So stages of inflammation involves the release of chemical signals from injured tissues, immune cells, and blood proteins. So some of the key ones that we want to know about is histamine, which is released by mast cells, and it causes vasodilation and increased vascular permeability. Then you have prostaglandins and leukotrienes. They help to amplify inflammation and recruit white blood cells. And then your cytokines, they attract immune cells and stimulate further inflammation. So these chemicals set the stage for subsequent inflammatory response by increasing blood flow, making capillaries more permeable, and recruiting immune cells to the site of the injury. So this is also from your book. You want to look, this is your different chemicals that we talked about. These are the sources of where those chemicals come from. And then this is the physiological effects, is what they do. So again, histamine promotes vasodilation of local arteries, and increases blood flow to the injured area, increases permeability of local capillaries, and promotes formation of exudate. So exudate is another word for pus. Okay, so when we are typing in our notes, and as you get into clinic and we're doing probe depths and measuring the amount of bone loss we have in periodontal disease, we are going to chart how much bleeding that they have in that area. And then also if somebody has an active perio infection, you will see pus come out from around the tissue, and that is termed exudate, and you will chart that as well. All right, so stages of inflammation. So in this stage, the blood vessels near the site of injury, they dilate, and this includes hyperemia, which is increased blood flow, and that's what causes the redness and heat, and it helps deliver more immune cells and nutrients. You have capillary permeability. This allows fluids containing clot factors and antibodies to leak into the tissues and form exudate. That can result in swelling, which is called edema, um, which is the accumulation of fluid in tissues. Okay, so swelling is edema. Erythema is redness. So these are all terms that we use when describing tissues, describing gingival tissues. So you want to know these. So edema is swelling in the area, and erythema is redness, and exudate is pus. Some other things that edema can cause is pain, because it can put pressure on nerve endings by all the swelling. And the fluid influx helps flush out pathogens and debris, while clotting proteins isolate the affected area and try and heal the tissue. All right, so phagocyte mobilization is the final stage of inflammation, and that involves the recruitment of immune cells to the site of injury. This occurs in 4 steps. So first you have your leukocytosis. This is when the neutrophils enter the blood, are released from bone marrow and enter the bloodstream in large numbers. Then you have margination, and that's when the neutrophils cling to the walls of the capillaries near the site of inflammation. Then you have your diapedesis, which is neutrophils that squeeze through capillary walls to enter into the affected area. And then you have chemotaxis, which is when neutrophils follow a chemical trail to the site of injury, where they can start to engulf and destroy those pathogens. And then later, after the neutrophils, because they're short-lived, so after all those die off, then you get your monocytes that arrive, and they transform into macrophages. And that is what helps to clean up the debris, and it helps signal the resolution of inflammation. All right, so here is an example. So you have a puncture, it allows the bacteria in, that triggers the inflammatory chemicals to diffuse and initiate the immune response. So the first thing that happens is you have your leukocytes, leukocytosis. So the neutrophils you see are the ones in purple, enter the blood from the bone marrow. They migrate into the capillary walls, the diapedesis. They flatten out and squeeze through the capillaries, and then they make their way to the area of injury, and they follow that chemical trail to where the injury is in the tissue. And here is a diagram of the inflammatory response that we've talked about, and you can look at that on your own. So we have antimicrobial proteins, which enhance the innate defense by attacking pathogens or inhibiting their reproduction. So 2 key types are interferons And interferons are proteins that are released by cells that are infected with viruses. So they function by warning neighbor cells. Um, Interferons signal uninfected cells to produce antiviral proteins that prevent viral replication. Um, and then activating the immune cells, they stimulate natural killer cells and macrophages to destroy the infected cells or pathogens. And then they have anti-cancer effects. So the interferons also play a role in inhibiting the growth of tumors by enhancing the activity of immune cells. And interferons are often described as the immune system's tattletales, right? Because they go and alert all the neighboring cells to the potential danger. So we have complement proteins, and they consist of about 20 plasma proteins that circulate in the blood in an inactive state. And their primary function is opson opsonization. And what this is the complement proteins coat pathogens. So they make them more recognizable and easier for phagocytes to engulf. Formation of the membrane attack complex, or MAC, is activated by complement proteins to form a complex that creates pores in the membrane of a pathogen, leading to its lysis and destruction. So basically, what it's doing is it creates little holes in, say, like a bacterial membrane, and then that which is it creates lysis, which lysis is like cutting or chopping up of that bacteria. So everything on the inside of the bacteria is released and it just kills the bacteria that way, right? So that's what lysis is. It does enhance inflammation. So the complement proteins, they stimulate histamine release, which increases the blood vessel permeability and attracts phagocytes to the site of infection. And complement proteins provide a critical mechanism for destroying bacteria and clearing infections from the body. So, fever is a systemic response to infection that serves multiple functions in the body's defense mechanism. So, how fever works is it has a pyrogen release. So, pyrogens are chemicals that are released by leukocytes and macrophages when they encounter pathogens. So, these pyrogens, they act on the hypothalamus, which is the body's thermostat, and it acts to raise the set point for the body temperature. So the increased body temperature inhibits the growth of many bacteria and viruses by creating an unfavorable environment for their replication. It also helps to enhance immune response because a moderate fever increases the metabolic rate of cells, which accelerates tissue repair and boosts the activity of immune cells like neutrophils and T cells. Fever also reduces the availability of iron and zinc in the blood, which bacteria need to multiply. So this also helps to further inhibit their growth. So things to keep in mind that while a mild to moderate fever is beneficial, extremely high fevers above 104 can be dangerous and may require medical intervention. And a fever is a natural and adaptive part of the immune response, and it signals that the body is actively fighting off an infection. And you can look in your book at this chart. It has the different types of um, immune response cells that we've talked about here. All right, so next we're going to talk about adaptive or specific acquired immunity. All right, so adaptive immunity is often described as the body's elite fighting force, due to its precision and effectiveness in defending against specific invaders. It is the third line of defense. And so some of the characteristics is has recognition and response. So adaptive immunity can recognize specific antigens on harmful substances or pathogens. It triggers an organized and powerful response tailored to eliminate those antigens. It does have a memory function, so the system has the ability to remember previous invaders. So upon re-exposure, the response is quicker and more robust and often neutralizes the threat before symptoms arise. And it has amplification of the inflammatory response. So the adaptive immunity enhances the effects of inflammation by signaling more immune cells to the site of infection or injury. It also has B and T cells as key players in this. So the adaptive immunity relies on B cells, which we're going to talk about, and T cells. So B cells produce specific antibodies that target antigens, while T cells directly destroy infected or abnormal cells. So the system, it ensures targeted and long-lasting protection against very specific pathogens while it's working in conjunction with innate immunity to eliminate threats. Okay, so adaptive immunity is unique due to several key characteristics that distinguish it from innate immunity. So specificity. So adaptive immunity can recognize and respond to specific antigens presented by pathogens, and this specificity ensures precision in targeting harmful invaders. It has memory. So once exposed to a pathogen, the immune system retains a memory of it. So upon subsequent exposure, the response is faster and stronger, and it often prevents the pathogen from causing illness. A systemic response. So adaptive immunity is not localized to the site of infection. It provides protection throughout the entire body. The system can recognize a vast array of antigens due to variability in B cell and T cell receptors. And adaptive immunity typically distinguishes between self and non-self, which reduces the risk of attacking the body's own tissue. These characteristics allow adaptive immunity to provide tailored and robust defense against specific threats. With acquired immunity, we have natural immunity, which develops through exposure to antigens in a natural setting. And so this is divided into two forms. You have your active natural immunity, which occurs when the body encounters a pathogen naturally. So like getting infected by a virus or bacteria, cold, flu, things like that. The immune system produces antibodies and memory cells to protect against future exposure to those same pathogens. So if you got chickenpox as a child, then you can't get chickenpox again as an adult because your body remembers that and will fight it off before. Passive immunity is occurs when antibodies are transferred from one individual to another without involving the recipient's immune system directly. So an example of this is a mother transferring antibodies to her baby through the placenta during pregnancy or through breast milk after birth. So things we want to remember about natural immunity is passive. Natural immunity provides immediate but short-term protection, and active natural immunity requires time to develop but offers long-lasting protection. So artificial immunity develops through deliberate exposure to antigens or antibodies, and it's also divided into two forms. You have active artificial immunity, which is achieved through vaccination, where a weakened or inactivated form of a pathogen is introduced to the body. The immune system recognizes that antigen, produces antibodies, and then develops memory cells to that. So, examples, MMR vaccine. I mean, there's so many vaccines that that applies to. Passive artificial immunity is achieved through the injection of antibodies produced in another person or animal. It provides immediate but temporary protection without activating the immune system. So, an example of this is receiving an anti-serum for snakebite venom. So, things you want to remember about artificial immunity is that active artificial immunity provides long-term protection as it activates the immune system, and passive artificial immunity is used in emergencies for immediate but short-term defense. So, there are two divisions of the adaptive immune response. You have your B cells, which are responsible for a humoral immunity, producing antibodies, and then T cells, which are crucial for cell-mediated immunity, which directly attack the infected or abnormal cells. Both types develop specific responses to antigens and create memory cells for faster future responses. And we'll talk about those more in depth later. So, antibodies are protein compounds that play a critical role in the immune response by targeting and neutralizing specific antigens. So, how it works is antibodies have specific combining sites that attach to antigens, which is foreign proteins. So this interaction forms an antigen antibody complex, which marks the antigen for destruction. So neutralization is when antibodies bind to toxins released by pathogens, preventing them from harming the body. Clumping or adulation is when antibodies cause pathogens to stick together, which makes them easier for immune cells to target and destroy them. Then you have promotion of phagocytosis. So antigen antibody complexes, they enhance the efficiency of phagocytes by marking invaders for destruction. In humoral immunity, this process is called humoral immunity or antibody-mediated immunity, as the antibodies circulate in the bodily fluids to identify and combat antigens. And then antibodies are a vital tool in the immune system's arsenal, and they ensure precision and effectiveness in eliminating harmful invaders. So here is example of those B cells, T cells, how they work to fight off infection. Okay, here we have complement proteins. There are a group of proteins that play a crucial role in the immune system by enhancing the body's ability to fight infections. And these proteins are normally present in the blood in an inactive state, and their activation leads to defense mechanisms known as the complement cascade. So in the inactive state, the complement proteins circulate in the bloodstream in an inactive form. They're ready to respond when triggered by pathogens or antibody antigen complexes. And the complement cascade is a series of reactions where one complement protein activates another in a chain reaction. So this cascade is a critical mechanism that amplifies the immune response. So some key actions is the formation of the membrane attack complex. The complement system creates tiny protein rings that insert themselves into the membrane of a foreign cell, such as bacteria. And those rings form pores in the membrane, and then it allows the fluids and the ions to enter the cell and ultimately causing that bacteria to burst open, which is called lysis. So it's cutting that cell open and allowing all the inside to come out and kill the bacteria. So opsonization is when the complement proteins coat the surface of the pathogens and mark them for easier recognition and destruction by phagocytes. You have the complement proteins stimulating the release of inflammatory chemicals such as histamine to increase blood vessel permeability and attract more immune cells to the site of infection. And the complement proteins work hand in hand with antibodies by amplifying their abilities to neutralize pathogens. So when the antibodies bind to antigens on the surface of the pathogen, they trigger the activation of the complement cascade, and that provides, a defense. So these complement proteins are a vital component of the immune system, and they kind of act as the bridge between the innate and the adaptive immune system to help eliminate pathogens. So this is example of that lysis where it has the rings that attach to the bacterial membrane, allows the fluid to enter in, and then it kind of bursts in, which is called lysis. All right, so phagocytes are crucial immune system cells that play a big role in defending the body against pathogens. So they work by engulfing and digesting harmful invaders and debris. So there are three main types. You have your neutrophils, which are the short-lived cells that act as the first responders to infections. They rapidly migrate to the site of infection or injury and engulf the pathogens. And neutrophils are the most abundant type of white blood cell, and they form pus when they die after combating the infections. So that's what we see. They are what we see when we see pus. Monocytes circulate in the bloodstream in an immature form, and they migrate to the tissues when they're needed. So once they're in the tissues, then they turn into phagocytes, which are long-lived and highly effective phagocytic cells. So macrophages not only engulf pathogens, but they also remove dead cells and debris to help contribute to tissue repair. Then you have your dendritic cells, and they're found at or near external surfaces, such as the skin and mucous membranes. And these cells act as to capture pathogens and presenting their antigens to other immune cells like T cells. So this antigen presenting functions makes dendritic cells essential for initiating the adaptive immune response. So phagocytes form that bridge between the innate and adaptive systems to help eliminate those threats and prime the body for more targeted immune response. So here is this example of how this works as well. So you have your bacteria, that's these little green things outside of the macrophage. They attach to by the non-specific receptors. The macrophages start to engulf around that bacteria and enclose it within the macrophage, where it releases those enzymes to help lysis, right, to explode or burst those bacteria, and then it spits that bacteria back out. of the macrophage. All right, so again, with the phagocytes, they ingest and destroy the foreign cells or other harmful substances, and macrophages and DCs act as the antigen presenting cells by displaying ingested antigens on their outer surface to trigger specific immune cells. Okay, lymphocytes are the most numerous immune system cells and are essential for both the innate and adaptive immune responses. They specialize in identifying and responding to specific pathogens. So there are two primary types of lymphocytes. That's the B cells and the T cells. So B cells are responsible for the humoral immunity, which involves the production of antibodies that target antigens in bodily fluids. And B cells also recognize specific antigens and differentiate into plasma cells to produce the antigens. Memory B cells remain in the body and they do provide long-lasting immunity by enabling a rapid response upon re-exposure to that same antigen. T cells are responsible for cell-mediated immunity and directly attack infected or abnormal cells. So there are several subtypes of T cells. You have your cytotoxic T cells, which destroy infected or cancerous cells by releasing toxic substances. You have your helper T cells, which assist other immune cells by releasing cytokines to enhance their activity. You have regulatory T cells, which help regulate and suppress excessive immune responses and maintain balance in the immune system. So together, the B cells and T cells play a vital role in the adaptive immunity so that the body can have precise and effective defense against very specific pathogens. So the development of B cells occurs in two primary stages, and it is essential for humoral immunity. So the first stage is the formation of immature B cells. This is when T cells in the liver and bone marrow before birth, or just in the bone marrow in adults, develop into immature B cells. So immature B cells are small lymphocytes that carry specific antibody molecules on their plasma membrane. And these antibodies enable the B cells to recognize specific antigens in the future. Their maturation and migration. So once they mature, B cells become inactive and migrate primarily to lymph nodes where they await activation. And activation occurs when the B cell encounters its matching antigen, and that will trigger your immune response. So B cells are pivotal in producing antibodies and establishing memory to enable the body to combat infections after repeated exposure. All right, so activation of B cells is a critical step in mounting an immune response. So how it works is the antigen binding. So inactive B cells become activated when antigens bind to their surface antibodies. So this interaction is supported by signal chemicals, which are released from helper T cells. And this ensures the response is specific. Then you have your clonal expansion. So once activated, the B cell begins to dividing rapidly to produce two types of cells. You have your plasma or effector cells and your memory cells. So the plasma or effector cells are cells that secrete large quantities of antibodies into the bloodstream and neutralizing antigens and marking pathogens for destruction. Your memory cells remain stored in the lymph nodes and ready to respond rapidly if the same antigen is encountered again. Then, when you have your secondary exposure to the same antigen, the memory B cells differentiate into plasma cells and produce antibodies more efficiently and effectively. So this process ensures a strong, specific, and lasting immune response. And this is the basis for long-term immunity by vaccines and natural infections. So plasma cells are the antibody secreting cells of the immune system, and they play a vital role in the humoral immunity as well. So what you need to know is antibodies, or also called immunoglobulins, um, are plasma cells that secrete proteins called antibodies into, or also known as immunoglobulins, into the bloodstream. So these antibodies are specifically designed to bind to the antigen recognized by the B cell that produced them. It has a very targeted defense. So by binding to antigens, antibodies neutralize toxins, they mark pathogens for destruction and prevent the spread of infections. So this precise targeting ensures elimination of that threat. And plasma cells are short-lived but highly effective, and they produce large quantities of the antibodies that provide immediate protection against the pathogens. And you can see in this chart here, there are 5 types of immunoglobulins: IgA, IgD, IgE, IgG, and IgM. So IgE and IgG are the ones that we talk about the most. IgE is involved in the allergic response and GI parasitic functions. So that causes inflammatory chemicals such as histamine, and IgG is a major antibody in the blood, prominent antibody of the secondary and late primary response, and readily fixes and activates complement passive immunity in newborns. So those are ones that you want to pay attention to. All right, so function of B cells. So indirectly, B cells produce humoral immunity. Again, it activates B cells, develop in the plasma cells. Plasma cells secrete antibodies into the blood, and then those circulating antibodies produce the humoral immunity. And that is the primary defense against toxins and extracellular microbes. All right, so the development of T cells occurs in 2 distinct stages and is essential for cell-mediated immunity. The first stage is the formation of immature T cells. So stem cells from the bone marrow migrate to the thymus gland, and in the thymus, the stem cells develop into immature T cells during the months before and after birth. Once formed, these immature T cells migrate primarily to lymph nodes, where they remain inactive until activation. In the second stage, it's the activation of T cells. So this is when the T cells become activated, when their surface proteins bind to a specific antigen. This activation is supported by chemical signals received from helper T cells. When it's activated, the T cells undergo clonal expansion, which is meaning they're producing 2 types of cells. You have your effector T cells, which actively combat the antigen by targeting infected or abnormal cells, and memory T cells, which remain in the body and provide that long-term immunity by responding to the same exposure. So these 2-stage development ensures that T cells are prepared to mount a precise defense against pathogens and abnormal cells. So T cells are central to the immune system's ability to combat infections and abnormal cells, and they play a key role in cell-mediated immunity. So we have cytotoxic T cells, which are killer T cells, and these cells directly attack and kill infected or tumor cells. They also release toxic substances such as perforins and granzymes, which poison and destroy the targeted cells. You have your helper T cells, which release chemicals called cytokines, and this coordinates the immune response. It helps to attract and activate macrophages to kill pathogens, and then it helps activate B cells to produce antibodies by releasing additional signal molecules. Then you have your regulatory T cells, which is also called suppressor T cells. And this releases chemicals that suppress excessive or unnecessary immune responses. It prevents autoimmune reactions by ensuring the immune system does not attack healthy tissue. And so together, all these T cell subtypes ensure balanced, effective, but targeted immune defense against various threats. So hypersensitivity occurs when the immune system responds inappropriately or excessively, and that leads to harmful effects. So there's two main types of hypersensitivity responses. One is allergies. So hypersensitivity to harmless environmental antigens are known as allergens. So pollens, pet dander, or foods. Um, Types of allergic responses is you have immediate allergic response, which involves the humoral immunity, which is the antibody-mediated immunity. It's common in reactions like hay fever or food allergies. Then you have delayed allergic response, which involves the cell-mediated immunity, which is T cell driven. And the typical examples would be contact dermatitis, like poison ivy, or a reaction to certain metals like nickel, which that could be very common in dentistry, where people can have reactions in the mouth to certain metals. So these mechanisms can demonstrate how overactive immune response can lead to either discomfort, inflammation, or it can be even life-threatening. Um, so autoimmunity arises when the immune system mistakenly targets the body's own tissues as foreign invaders. So this inappropriate response to self-antigens leads to various types of immune diseases. So autoimmunity occurs due to excessive or inappropriate immune response directed against self-antigens, and it causes autoimmune diseases. And this is when the immune system, again, fails to recognize that self-antigens are harmless and attacks the body's own tissues instead. This also can happen in dentistry, where the body, there are certain oral pathogens that look similar to cells in the heart. So your body can develop a immunity towards these pathogens, or it sees it as these pathogens as harmful, and it builds up immunity to them. And then as those are floating around in the bloodstream, and it will recognize certain cells in the heart, and it thinks that it is a bacterial pathogen, it starts to attack the heart tissues. Another example would be a systemic lupus. So it is caused by numerous antibodies that targets a variety of tissues, and it leads to widespread inflammation and tissue damage. Symptoms often include fatigue, joint pain, skin rashes, organ dysfunction. So this autoimmunity highlights, the delicate balance required in the immune system to differentiate between self and non-self, as well as consequences when that balance is disrupted. Alloimmunity occurs when the immune system has an extensive reaction to antigens originating from another human. So this immune response can lead to complications in specific scenarios. So alloimmunity is an excessive reaction of the immune system to antigens that come from another person. This would be like in pregnancy. So alloimmunity may occur between the mother and fetus when the immune system of the mother reacts to fetal antigens. Tissue transplants, so rejection syndrome occurs when the immune system attacks transplanted tissues or organs because they recognize them as foreign. So this is a major concern in organ transplantation and requires immunosuppressive therapy to prevent that rejection. And alloimmunity emphasizes the challenges of the immune system, distinguishing between self and non-self when antigens come from other humans. So immune system deficiencies occur when the immune system is unable to provide an adequate defense against infections or other threats. So you have congenital immune deficiency. It's also known as immunodeficiency, and it is a rare condition caused by improper lymphocyte development before birth. Uh, Severe combined immune deficiency, or SCID, it represents a group of rare genetic disorders that disrupt stem cell development and results in severely weakened immune system. Individuals with SCID are highly susceptible to infections and require specialized treatments such as stem cell transplants or gene therapy. Acquired immune deficiency develop after birth and are caused by external factors. So this is AIDS. Acquired immune deficiency syndrome is AIDS. It develops after birth, can result from infections, medications, or environmental exposures. Um, AIDS is caused by the human immunodeficiency virus, which infects and destroys T cells, specifically CD4 plus cells. HIV is transmitted through direct contact with infected bodily fluids, such as blood, semen, vaginal fluids, or breast milk. And treatment is a combination or cocktail of antiviral drugs called antiretroviral therapy, or ART, and it can reduce the progress of HIV infection. All right, so if we were in class, we could do this activity, but since we're not, it could be something fun that you do on your own, not required, but creating comic strips that might help you understand or visualize the immune system a little bit better. So here are just some examples of some comic strips that students have done in the past. And as far as your quiz, here are some things to focus on for your quiz on immunity.